I saw a patient once in the emergency department, and she had burns on her hands, and she was not there because of the burns on her hands, but I thought it was really unusual. The truth is, it was one of our residents who picked it up, and I thought it was such a great pickup. It was seeing really the big picture, and we realized that she was really struggling to cook, and those were burn marks from boiling water. And so that took us in a totally different direction for her. This is Sick Health with Kevin Ban, MD. Our show helps you navigate our broken healthcare system and take control of your own health. I'm Kevin Ban, an emergency physician with over 25 years of clinical experience. Most recently, I was the chief medical officer at Walgreens, where I led the national pandemic response.
Hello, I'm Alex Wallace. I'm a longtime journalist. I was an executive at NBC News and most recently at Yahoo.
Our healthcare system is severely broken. The goal of this show is to keep you and your family as far away from it as possible by offering to keep you healthier. Oh, that's right. By offering to keep you
tips.
Offering tips. I've tried to do this mission statement like 4 times and it's not working. So I'm actually going to read it because it matters. Our healthcare system is severely broken. The goal of this show is to keep you and your family as far away from it as possible by offering you tips to keep you healthy. And if you do have to deal with it, we'll be there to help you. That is what we're all about at Sick Health with Kevin M. Ban.
Oh, you're so f***ing close.
That is what we are all about at Sick Health with Kevin Ban, MD. Bam!
Kevin Ban has passed the reading test. Okay, the best way to support the show at no cost to you is to subscribe to our YouTube channel, which is Sick Health with Kevin Ban, MD. We have 2 great cases on today's show. The first one is aging in place, which is a real growing topic of interest and attention. And the second one, this is a little bit of a tease for you, is the healthcare provider hiding in your wallet.
Today's episode is brought to you by C2 Sense. C2 Sense is working hard to bring lab quality diagnostic equipment into the home, priced for everyone. Learn more at haloreader.com.
Kevin, before we get into aging in place, gotta ask you, I think, in fact, I know those are posters behind you. Where are I'll tell you, I'm sitting in my son's room, which is now my home office in New York City. Where are you sitting?
During the pandemic, I went down into our basement. You know, we had this storage room full of things we don't want. And that became my project. I wanted to create a media room. Okay. When you and I started discussing doing this show, my wife was like, look, I'm good with all of this. You cannot set up and dominate a good room in our house. So this has become my little dungeon. These are posters of movies I like. And it's actually kind of good because I'm just kind of squirreled away in here.
I think it looks great. Let's get to aging in place. I mean, this is something you and I have talked a lot about as friends. And I know I spent a lot of my time with peers talking about this because in middle age, your parents start aging and having to think about moving out of their houses. I would also say it's something I've begun to think about, as you see it happening to your parents, you begin to think about it happening to you and what do you want to do?
I don't think that there's anyone I know who's not thinking about this or actively involved in this. My mother will be 83 years old this coming June. And, she lives independently and we work really hard actually to help her get there. She's an avid reader. And I called her last night knowing that we would do the show. And I was like, Mom, how many books have you read since January 1st? Okay. So she's like, hold, and called me back later, went down to the library because she, of course, checks her books out at the library. And she said, number 1, over the last 2 years, I've saved over $2,000 based on the books that I've checked out. And to answer your question, how many books have I read since January 1st? Well, she checked out 139. Okay. And I was like,
wow,
what? And she's like, well, I don't read them all. I read the first 20 pages. And if I like the book, I keep going. If I don't, I set it aside. So I said, okay, of the 139, how many books have you read? She thinks about 100 since January 1st, which I was like, whoa. But I'll tell you, my mom leads a very active life. She has friends. I tried to get her to exercise forever. And of course, she wouldn't do it until, of course, Margie decided that she was going to, and this is real, that Margie was going to exercise. And so now my mom exercises twice a week with Margie. And, look, this is a process, Alex, you know this. A couple of thoughts here to start. The first is that, and I've said this before in previous podcasts, being prepared is everything here. So if you're listening to this and you're like, I have no idea what you guys are talking about. My parents are independent. They're doing great. Like, now is the time to start at least thinking about it. This is an iterative process. And we'll obviously go deeper, but you've got to have some sensitivity towards your parents and what it is like for them. And so I always lead with, as we age, we become fiercely protective of our independence and our autonomy. And when you bring up the conversation about, hey, we're wondering, where are you going to be when you can't be at home? That scares people, and that can create a certain amount of fear. And so what I encourage people to do is to really think about this as a process, and one that you share when appropriate and when possible with your parents. Okay, so you really have to be inclusive of them, and and understand that they may perceive this as interference if you start to bring up these topics. And the more you think about their self-esteem, their independence, their autonomy, I think you're going to be more successful. One last thought here, and that is, don't do this alone. Okay, if you have siblings, engage them in it. Not everyone can play the same role. Not everyone can do the same thing. But if you can be at least collectively more or less on the same page, that's more powerful. I have 3 siblings. I have 2 older sisters and a younger brother, and we all work collectively to help my mom.
Just a tactical question. How involved in their actual medical care or a single parent's medical care should you be? Should you go to their appointments with them? Should you try and talk to their doctor?
I think it really depends. People end up on different ends of the spectrum on this. Let me talk about my mom, who I, of course, cleared this with her first. My mom wants me and my siblings to be involved in her medical care. They want us to be involved in her financial life. So the truth is, I took over my mom's finances over 20 years ago, and that was a relief to my mother, and she wanted that. But I know people, I have friends whose parents are fiercely independent and see that is a form of interference that they don't want any part of. So you really have to know your parents here. And so what I would say is it depends. I love the idea, though, of making sure that when you go to a doctor's appointment, that you're capturing all the information necessary. So number one, you might ask if it's appropriate, if you can attend and be there and be a second set of ears. I want to double pump the brakes here. It is really hard for everyone, including me, to be in a room with a doctor, especially if there is any type of emotionally charged issue. I've had that before with my kids, where I immediately was no longer dad, or strike that, I was no longer a doctor and I was dad, right? And I just wasn't absorbing as much. That's normal. So you have to come up with techniques, and having another set of ears is one technique, but it's not the only technique, Alex, okay? The next piece is be prepared for the doctor's visit, okay? And you can do that by writing down the questions before you go into the room. When you have a notepad and you have the questions, even if you sort of become forgetful because you're overwhelmed by the information, you can kind of anchor back to the questions. What I really love to do, and I've started doing over the last several years, is using the voice memo on my phone. I have an iPhone and I use a voice memo. Okay. I've heard people say to me oh, well, my doctor might not like that. Again, I want to go back to a previous episode where it's your doctor is your partner, is your consultant, and you need to say, hey, look, this is a lot of information for me. I just want to record it so I can reflect back on it and make sure I get everything out of it. So these are really simple things that you can do. Now, there's one last thing, which is sometimes, you might join the doctor's appointment with your parents toward the end. Now, that kind of comes up to what your parents want. And so I would ask them. But again, strategies to make sure that you're getting all the information that you need.
Okay, there's so many complicated things in this whole process. What happens if you aren't the right person to be interacting with your parents, or if your siblings aren't the right people, or your parents don't want to interact with you about this? Is there an alternative?
This happened to me actually earlier this week with a really close friend. And, one of the things that's very interesting about our parents' generation is that they really respond to authority. Okay. And I've learned that even just with my own patients, I would come into the room and say, "Hi, my name is Kevin Ban." Okay. And inevitably, my older patients would say, "Hello, Dr. Ban." And inevitably, my younger patients would be like, "Hi, Kevin." And I was good with it all. I really just don't call me Dr. Kevin. That doesn't like work for me. But you can see that there's an element there really respecting authority. And there are times, folks, when you are just not the messenger. Either because you're their child, and while they say people change, but relationships never do, or because they're private, or for whatever reason. Oftentimes, what you want to do is to kind of go with that third party, almost like a consultant. And I had a conversation with a friend earlier this week about it. Her father-in-law is really struggling taking direction from his kids. And so what they've decided to do is to hire a care coordinator. Okay. And a care coordinator is a person who will come in and do an assessment and work with the person to get them to where they want to be. I can tell you that the trend nowadays is for everyone to stay at home. That's why we're calling this aging in place. That's what's called in general, is people want to be at home. And so we're looking for strategies to make sure that they can do that safely.
How do you find a care coordinator?
This is a great question. More and more, you're beginning to see, independent care coordinators. They often tend to be nurses, although backgrounds vary. They're starting to, have websites and to publicize. It's becoming a thing. But what I would say is start with your doctor, or start, more importantly, even with your parents' doctor, because they're probably dealing with this already. And so that person is likely to be local. They'll be vetted because they've been used before. So while you can find people online, and that's reasonable, I usually try to go with sort of the trusted recommendation that often comes from a physician who's involved.
Got it. Okay, so there's worrying, and then there's, which, we all worry about our family all the time, or at least I do. And then there's things that maybe should raise the level of worry. Are there things that you might see, that you would see as a doctor, that you've seen, that you're like, this is something where you need to take, that's a red flag, where you actually need to be slightly more proactive?
Red flags, things that make you think, whoa, there's something going on here. I need to dig deeper. And this is all about safety. So I want to come back to that point. This is all about your parent being safe. So I'm assuming a couple of things in this advice that I'm giving you. And that's number one, that your parent is healthy enough to live alone. Okay. And then number two, that they have capacity. Okay. And when a doctor or provider refers to capacity, what we're saying is that they're able to sort of process information, make a decision, and then communicate that information. Okay. Capacity. If your parent is either too unwell to live alone or does not have capacity, that's a whole different conversation. Not one that I'm afraid of, and one that I would like to take on in a future episode, but I am making those two assumptions right now. So the red flags, what are they? Okay, the first thing that comes to mind is that your parent is starting to not keep up with what we call the ADLs. And that stands for the activities of daily living. Okay. And it's exactly what it sounds like, the activities of daily living. So, you start to notice that their hygiene is becoming a problem. Okay. That they're not showering, that their hair is unkempt, that they're not clipping their nails. All of these things are suggesting that something is off, that this person is not doing what they need to do. I think about how they dress, right? If it's wintertime and they're wearing shorts, this is a problem. This is a red flag. Are they able to walk, move around? Can they transfer? Do people know that term, Alex? Like if I say
Uh,
transfer?
What does that mean exactly?
So can they get out of bed? Can they walk into the other part of the house, into the kitchen, into the bathroom? Can they sit down in a chair? Can they get out of that chair? Right. So that's transferring. So, if they're beginning to not be able to walk, if they're not able to transfer, eating is a big thing. If you start to notice that your parent is losing weight and you're trying to figure out why, then, you want to dig deeper into that. I saw a patient once in the emergency department, and she had burns on her hands, and she was not there because of the burns on her hands, but I thought it was really unusual. The truth is, it was one of our residents who picked it up, and I thought it was such a great pickup. It was seeing really the big picture, and so we had a care manager in the emergency department who came over, and we realized that she was really struggling to cook, and those were burn marks from boiling water, and so that took us in a totally different direction for her, and ended up really making a difference in her life. And then the last red flag that I can think of is falling. Okay. And falling is a big deal. Okay. And safety in the home is a big deal. When I hear that someone is wall surfing, again, I'm going to pump the brakes. Do people know what wall surfing is?
No, but I hope it's not something that I do when I'm sleeping.
Yeah, and it has nothing to do with the surfboard. But folks who are unstable will begin to put their hand on the wall and they'll kind of support themselves. It's called wall surfing, and that's a very alarming sign. Why? Because falling, especially if it's because you have loss of balance, loss of core strength, if you fall and break a bone, I mean, the likelihood of death within 30 days is in the order of 10%. And over the course of the next year is like over 30%. So this is really an ominous sign and certainly a red flag.
Okay. Changes in behavior. What red flags should everyone be alert for?
Right. So a couple of thoughts here. I'm always very mindful of my mother and whether or not she's showing any signs of depression. Okay. So my mom is interested in, we talked about it, in reading,
Book reading.
book reading. Mom, keep going. I love it. And, she likes to have lunch with friends. She gets together periodically. They see a movie. Like she's living her life, and anytime you see a loss of interest or a loss of motivation, when they're not doing the things that they love. Like if I ever heard that my mom was not reading a book anymore, then that would really concern me. If they have changes in sleep, either too much or not enough, all signs of depression. And, I would say, pay attention to that. Often it needs to be treated. And of course, you're going to need a healthcare provider to help with that. There are other changes in behavior. This sort of moves into like more of a change in mental status. And again, I feel like really super doctorated. People know what that means, a change in mental status.
Okay, that one we got.
That one. Well, so some changes in mental status are happen really fast. Okay. And again, Mom, you were like really prominent in this one today. Thank you for being a good
We
sport.
love you.
100%. And so the what happened with my mom is actually during the pandemic is that my sister called me and said, "Hey, something's up with Mom. She's talking really weird and everything." And so I immediately called my mom, and she was a little loopy, a little goofy, And what happened was that she had developed an infection. Okay. And she lives alone, so no one was around her. And when my sister called her, my mom was, because of the infection, quite honestly confused. And I called my sister back. It was my older sister, Kate. I have two older sisters, Ellen and Kate. And I said, "Kate, Mom's got something going on. I suspect it's some type of infection. You got to go pick her up and take her to the hospital." And my mom ended up being admitted to the hospital. She had a pretty severe infection. And, she did great. But those types of very quick, acute changes in mental status, of course, are deeply concerning, and you want to make sure you intervene there. There are other things, though, and this may be more progressive. This may be slower. Their forgetfulness. Now, we are all forgetful, but I'm talking about really notable forgetfulness. And this isn't subtle when it happens, and we joke a lot about it. But this is something that ought to catch your attention. Bad judgment. is something that jumps out as a red flag to me right away. Um, and then, and this happened again to another friend of mine's. This time, her mother, she would go out for walks. She was a big walker, and then she started getting lost. Okay, and it happens to people when they drive too. They drive, and then they kind of, forget where they are. They can't get home. So clearly, all of these things are concerning, and you want to act more quickly should those things happen.
Okay, so let's say you see one of those signs. And it's interesting. I like how you delineated, because I think we all, you forget one little thing and you've immediately gone to, this is not going to end well, but that there's regular forgetfulness and then there's something to be taken seriously. So let's say you do see one of these signs in one of your parents or both your parents. How do you begin? What are the steps actually to make a house or a home, an apartment, more secure, safe as a place for them to live?
When I earlier suggested that people become proactive, this is exactly what I was referring to. Don't try to do this all at once. Recognize it as a work in progress. Be satisfied with, a half step forward. I said that recently to a friend who's dealing with all sorts of problems, where the siblings aren't agreeing and the parent is not wanting help, and it's like, hey, you just have to like climb this mountain like one half step at a time.
Can I just make one aside?
Yeah.
Sometimes I wish I was a doctor, but then when I talk to you, I realize one of the downsides of being a doctor is that every friend calls you every day with 7 medical questions.
Yeah. I have to say, like, this happens to me all the time. And, I've always looked at it like I got this gift, which is this body of knowledge around medical understanding. And it's a gift I share. So, and in fact, has a lot to do with why we're doing this show. This is something that you and I talked about, which is I have a lot to say about this healthcare system, about how to stay healthy. And I feel like I've had this experience I want to share with people. So I'm always good with it, but I'm also always good with empowering people to take like control of their own health.
Okay, I rudely interrupted. Back to things you can do to make your parents' house safe for them.
Yeah. I mean, start with a home safety assessment. That's where I go to first. Okay. Now, do you necessarily need to involve your parent in this? Again, it would be better to respect their independence and their autonomy. But quite honestly, folks, you can go into their house and do this. How do you do it? Start with area rugs. Okay. They are very, very problematic. Okay. Even if you put what are those little mat things that you put
but
under?
I have a little area rug right outside my son's room, and I slip on it every day.
Yeah, because even if you can prevent
and it has one of those little things under it.
Yeah. So, right. So even if it didn't, the rug tends to sort of pooch up over here and it becomes a trip hazard. And so area rugs, gone, get rid of them. Okay. Which then makes me think of shower and bath mats. So get into the bathroom. That's a place where a lot of falls happen. Make sure that they have a bath mat in their shower. Okay. Ideally, they should.
You mean like a rubber mat, like mat.
That rubber, yeah, exactly.
Got it.
Like that rubber mat that you put in the base of your bathtub or shower.
Yep.
What was interesting, and hello, mom, again, this is going to be, I was like, you know what? I don't like the fact that my mom has a tub and that she has to step into the tub, right? So like, let's rip out the tub and, just have like a 6-inch little thing that. And then that turned into a total bathroom renovation. But anyway, it needed it. And I got to be honest with you, like I just was trying to do everything I could to keep my mom safe. The next piece when you're in there is that oftentimes people need bars either near the toilet or in the shower. So you might, consider doing that. The next part of the house that I think can be very difficult are stairs. And so at the very least, there should be handrails. Again, for my mom, she lives on the second floor. I tried to convince her like a long time ago, 10 years ago, to move to the first floor of the apartment building that she's in, but she didn't want people up above her. Don't blame you, mom. I get it. And so what we did is I put in one of those chair lifts. My mom does not use the chair lift, although she'll put her groceries or anything she's kind of carrying on that, and then she walks up the stairs, which is a form of exercise for her, but she doesn't have to balance, the groceries and also have to navigate those stairs. I guess the last thing that comes to mind are really super basic things. Make sure that the carbon monoxide detector and the smoke detector are working. And that's something that you can do. Like, write those things down, go in the house, make an assessment. My guess is that, you can get rid of some of those hazards pretty quickly.
It's another kind of tactical question, but how do you make sure they are taking their medicines?
Yeah, some patients are very, very good at taking their meds. And should they miss one dose, they're on the phone with their doctor, which I do. There are other people that have a really hard time with it. Medication adherence is a really tricky topic, and it's alarming how many people never pick up their medications. Number one, and then number two, like, are taking them wrong when they start them, and then within 6 months aren't taking them at all. But you do need to have a strategy for your medications. And so what my mom does is she's got one of those pill boxes, and she's very careful to do that. I do that as well, because I take some supplements, and I have a pill box.
It
And
keeps it track of it.
yeah, it keeps track of it, and like, I
Yeah.
never miss it as a result. So that's a really important part. One last thought here is that where I saw things go badly frequently in terms of caring for a patient was that the medications weren't being taken, at the right time. The advice I give is go in, clear out the medicine cabinet, make sure that the only medications available are the ones that the doctor has, prescribed, and are the ones they ought to be taking, and then come up with a mechanism to make sure they take it on a regular basis.
Okay, so how does one make sure that let's say you fainted at your house and s- you the EMT gets called. How do you if you're passed out, they can't how do they find your medical information? Is there something you should do just to kind of keep that in a specific place so that it is always on your person?
Yeah, so this comes back to preparedness. Again, being proactive, having the information before that happens is key. So we do this for my mother. And in fact, I've got on my iPhone, I have a notes section, and I have all my mother's medication and their doses. Okay. She also has a list of her medications, and you can imagine this, written down on a piece of paper and in her wallet. My two sisters, Kate and Ellen, both have the medication list. And I'm pretty sure, I don't know if my brother does, but his wife Jenny does. And so, like, we have like a redundant system so that if my mom ever ends up somewhere and the providers need to know which medications she's taken, we've got that covered.
By the way, that's probably not bad advice for any of us. I mean, any of us could be in a car accident and need to have evidence of our medical histories on us.
Yeah, without question. I mean, this is kind of 101. If you are taking medications, certainly if you're a diabetic, and are prone to hypoglycemia, which you know what that means because we did the whole hypoglycemia thing, right? Like, anything you can do to alert people and then let them know what type of medical problems you have. And so let me go into that. So, number one, I think what's useful to have on that list is past medical history. So what type of medical problems do you have? High blood pressure, diabetes, any type of medical history. Allergies, key. Make sure you put medications that are the patient either can't tolerate or they're allergic to. And then lastly, the medications with dose. That's enough. That is adequate. You don't need, pages.
Do you
But
need blood type?
yeah, look, there's no reason not to have blood type. Absolutely. Sure.
Kevin, are there any medical alert systems? I think maybe you can you can have it on your smartwatch. Are there any things that you recommend?
Yeah, this is a really interesting one, Alex, largely because the moment you start talking about a medical alert, especially the ones that you might wear around your neck, parents really start to bristle. As Americans, we really cherish our independence and our autonomy. Okay. And, there are some great sides to that. But when you flip it and say, like, hey, now's the time where we really don't want you to be independent and we really don't want you to be so autonomous, it's hard. In fact, our healthcare outcomes can subsequently be worse because we find ourselves more and more isolated. What I think about is my wife. I'm married to a woman from Florence, Italy. She was born and raised there. Her parents still live there. And there, it's so much more common to be kind of community and family focused. So when they get to this stage in their life, they don't really perceive it as a loss of independence and a loss of autonomy, which is fascinating, right? And subsequently, the aging process in Italy is somewhat easier actually than it is here because they don't have that embedded in independence and autonomy. So folks, when you go to your parent and say, hey, I think I'd like you to wear that I've fallen and I can't get up type of thing, expect pushback. But to your point, you can be really elegant in how you do this. And for some people that is a very good solution, and many people use that type of alert system. You can
Which
use
is what? Sorry, a smartwatch or a actual
Oh, I
something
was
around your neck?
referring at that point to the medical alert that people have. They either wear it around their neck or they can have it in their pocket. And if
Got
there's
it.
a problem, they just kind of touch a button and it alerts a medical
Got it. Got
response
it. Okay.
or an emergency
Okay.
response. But there are other solutions. You mentioned it, a smartwatch, for example. Now they've become more sophisticated and they can begin to pick up on activities and they get to know when a person normally wakes up, when they move around, when they're taking a nap. And then if you're off that, or if you haven't moved for a significant amount of time, then it will alert you. And interestingly, I'm getting together with my siblings in June, and it's one of the things I want to talk to them about. But I guess if they watch the show, then they're going to learn about it sooner. But that can really work. If not, then you have to think about very basic things, and that could be installing a phone in the kitchen, in the living room, in the bathroom. Okay, if your parent doesn't feel like they can keep up with the technology, but maybe a cell phone can be sort of a decent a compromise. They don't want to go with maybe a smart watch or something like that, but they can have a cell phone that they keep in their pocket and is kind of ready. So should they fall, if they have any problems, they can make a quick call.
Got it. Okay, I'm going to try and sum up. You've been a font of information, as always, today. Okay, first of all, I thought what you said at the beginning about like really being prepared. I think that's step number one. That it's a process, that this isn't like you check it off. I like to check things off my list. I guess this will not be one I will get to check off my list very quickly. So this is actually a real process. It's not an event. Making sure that your parent or loved one is fully part of this whole process. I love this idea that there are actually a professional caregiver that might be able to help if you are not the right person to do this. I really loved your list of red flags, things we should just really keep an eye out for, and then things that you can do. I'm taking all the area rugs out of my house at the end of this show, but things that you can do just now or begin to think about doing in your house. And then lastly, I just think it's very interesting actually what you said about independence because I think it does speak to we are all, I mean, that's what we are. We are fiercely independent people. And probably in aging, that maybe is a complicating factor.
That independence can be really powerful, and it keeps people doing well. And then it has this sort of other side of the coin aspect to it. The last thing I would add to that summary, which was great, I mean, you picked up on all the most important points, is that, think of a plan for the short term, and then come up with a plan for the midterm, and then come up with the end game. Okay. And this is something that will slowly allow you to set expectations. As I was talking about the activities of daily living, there are really good assessments that people can use. And let's drop that, Chev, into the show notes so that people can have that. Okay. But in sort of setting expectations and opening a dialogue and letting your parents know that you have complete respect for them and their autonomy, I think you're going to get to a better place because the opposite tends to sort of turn out to be really contentious, and it's really hard to move forward.
Okay, we're going to take a break for a message from our sponsor, but I just want to say when you get back, I learned a lot of things from you. One of them recently was that it turns out I actually have a powerful health tool in my wallet that I was unaware of.
C2 Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2 Sense's goal is to use their patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or a headache, keep your eyes out for C2 Sense as they are developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com.
Case 2. So, one of the reasons we are doing this show is how hard it is for many people to access medical care. And when you and I were talking about this the other day in preparation for the show, you actually told me about medical care that I did not know that I had access to. So please, you've now told me, but please tell the rest of us.
Okay, let's start with people who actually have medical insurance, and then I'm happy to talk about people who may not, okay, because I think it's important to discuss both. So earlier you mentioned that I get a lot of phone calls for people asking about health. Oftentimes they have an acute medical problem and they want me to help with it. So a few months ago, I think it was in the beginning of the year, started playing with the idea of, hey, what if I just said to them, hey, do you have healthcare insurance? And if they said yes, I say, okay, take out your healthcare card. First thing you need to know is that in healthcare, we call insurance companies payers, all right? They're the ones who pay. So I started to refer to this as let's make the payers pay, okay? We pay our premiums, let's get something for it. And it really turned out to be overwhelmingly successful. I had my nephew who called. He had a new rash that he wasn't sure what to think of it. And I happened to be, I mentioned earlier that I'm married to an Italian. I was over in Italy visiting with her family. And I said to him, hey, go ahead and take out the card. And he was able to get care.
But wait, what am I looking at on the cards?
On the back of it, oftentimes you'll see a helpline, or it'll say something like provider 24/7 or virtual care or telehealth or something. And so what I encourage people to do is to call that number. Now, I have been doing that over the course of the last several months, and it has been overwhelmingly successful because people realize that, wait, number one, when I call this number, it's my payer, it's my health insurance company. So you know that whole thing about, am I in network? Am I out of network? Folks, you're in network. Number two, they tell you exactly how much your copay is going to be, okay? Usually it's around $20, okay? Number three, they really care that you get follow-up, so they will make sure that you follow up. And if you don't have a primary medical doctor, oftentimes they will help you find a primary medical doctor, and then people wait for it in your network. Okay, all the things that can be tricky. So this is so powerful. And largely what I do now is I say to people, hey, I'm happy to help you. Like, I'm here, but try that first. It works.
What if you don't have insurance?
Yeah, so that's a more tricky problem. If we're talking about something like you have an upper respiratory infection, you've got a cough, you got a cold, nasal congestion, a headache, maybe you have a rash and you're trying to figure it out. The most expensive place for you to go and get care is the emergency department. Okay, that is going to cost a lot. Even going to an urgent care can cost a lot. It is preferable than going to the emergency department, but it's not as good as starting with virtual care. The other thing about that, and I'll give you some recommendations there, but the other thing about starting with virtual care is then they can navigate you. And if they don't like what you're saying, you say, hey, I've got chest pain. They might just say, hang up the phone, call 911. So you've got someone who's got medical information, medical savvy that can help navigate you through. When I think about which types of providers, virtual care providers, there is a service here. It's called One Medical in the Boston area. I believe it's also in Chicago and in California. And they were purchased by Amazon. Okay. When I was referring people for primary care, I would often refer them to One Medical, and they did a really, really good job. And
Wait,
and
so
now,
how would you find the number for One Medical?
right? So that's the interesting thing. Now, One Medical, that it's been bought by Amazon, Amazon has made this service available to people. Okay, so if you have Prime, then it's an additional cost, and I'll get it wrong, but I believe it's under $10 a month. Okay, and if you live in a city where they have offices, you can go there, but you can use virtual care. So if you are looking for virtual care, you don't have insurance, consider that Amazon has this opportunity, but they're not the only ones. And I should also mention, I just made that plug. That's based on my experience with One Medical. I also happen to know the guy who leads the virtual care division at Amazon, and I think the world of him. He's an excellent doctor. And so that's just based on personal experience. I have no financial relationship with any of these folks I'm about to mention. There is MD Live, there is Teladoc, there is Amwell. I mean, there are a series of different virtual providers. And I think that they do a good job of helping you with really basic things. And then if it's more serious, then they're going to tell you, hey, this is serious, and they're going to guide you.
So now the rest of the afternoon, I'm going to be flipping over every other card in my wallet to see what hidden gems there may be back there. First, thank you, Kevin. So much good information today. Thank you all for watching. We would love to hear what you all are interested in, what topics, what concerns, things that you would like to see covered. Please go to our YouTube site, put them in the comments. Sick Health with Kevin Ban, MD. And then lastly, Kevin has actually, I'm coming round to this rather beautiful tradition that Kevin has in his family called sharing beauty.
Right. So we've been doing this for over 12 years. And the idea is that when you see something beautiful, you shout it out. Today's is a friend of mine, Jordan Matter. He's been a longtime friend. Interesting, Alex, I've known him just about as long as I've known you because I met him.
65 years?
63, but we've been friends for over 25 years, and he published this really beautiful book called Dancers Among Us. And so what I've done, and Chev, again, I'm going to remind you to drop this into the show notes. I've got a video of the making of the book, and specifically, I found one that I was involved with, which was in the video. It's about 3 minutes long. At 1:18 into the video, we're in a hospital. And the idea of Dancers Among Us is that he would point out a beautiful moment that we might not think of as beautiful. Think about someone who's in cardiac arrest and a group of people trying to save that person's life. And so, of course, we simulated this scenario, and we did that at the hospital where I worked for about 19 years. And at 1:18, you're going to see that picture. So that's how I'm sharing beauty this time. Folks, I want to thank you for being a part of our community. We deeply appreciate it. This show was produced by Batsheva Gez. Thank you, Chev. And we'll see you next time.
See you later.
This show's content represents the personal opinions of Alex Wallace and me. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.